Hi, my name is Dr. Julie Hebert, and I'm at the University of Texas at Tyler. And my presentation today is on fostering student success in service learning during a pandemic. So the course objectives today is that the learner will understand the definition of service learning, that they will be able to verbalize and describe the benefits of providing service learning, and that they will be able to gain a new insight on developing a service learning project during a pandemic. And the pictures on here are actually some examples of some of the materials that our students use during their service learning project. So when we look at what is service learning in a post-secondary education pretty much provides that educational learning experience that combines learning objectives within the community to provide hands-on learning and critical thinking to students while they're assisting in the community. So it is actually more elaborate than just volunteering. It actually helps them to think and be able to provide reflections and learn the different skills to help them with their career. So the question that has arisen is, how has service learning changed during the pandemic? Well, prior to this, the students at a Master's of Occupational Therapy program were able to select a community site to provide service learning at. And with the recent pandemic changes, it has closed several sites and pretty much put students on hold and not allowing these students to attend in person. So what is the dilemma? If we look at how do you pretty much provide or modify a service learning experience pretty much while maintaining physical social distancing, but yet still meet the overall learning objectives in the course. If you look to the right, some of our students decided to provide this learning experience by providing a virtual presentation this year. So when the university program first decided to kind of look at how we could restructure the service learning. The instructor pretty much reviewed looking at, okay, what are the needs of the community out there, uh, taking a needs assessment between the different organizations on how service learning could be provided even though the students would not be able to be involved in the community, and how that would look. The instructor pretty much looked at taking the students and dividing them up into groups versus individually normally providing an individual service learning experience. So with these groups that were divided, there was 5 different types of service learning groups that consisted of 4 to 6 students per group. And so the first group that was formed was a university mental health and wellness initiative. A second group that was looked at was a mental health and wellness program for Parkinson's patients. A third group looked at providing a sensory room for a pediatric foster facility. And a fourth group looked at sensory rooms for veteran PTSD women. And a fifth group looked at providing a sensory path for an elementary school. The expectations of each service learning group were that they were, one, going to meet with the facility or the community partners, with their directors, their teachers, their board members, to have initial meetings as well as follow-up meetings in regards to their proposal. They were also expected to meet together as a group and figure out how they were going to divide their tasks. They were looking at also, as they were progressing along, keeping a log of their time and commitment with this project. They were also expected to look at each time that they did, whether it was providing an educational opportunity or making a project, that they would also do a reflective journal piece about their learning experiences. And if they were to make educational handouts, they were also expected to place them in a folder for an example. And so as we progress through this learning experience, service learning experience, the students at the end of the semester presented their service learning through a poster about basically to explain the facility, the organization, the mission statement, and their expectations of this entire project and the experiences that they gained. So the first service learning project was the University Mental Health and Wellness Initiative Program. These students began by meeting with the Student Engagement Center at the university and volunteering, figuring out volunteer experiences. They began by volunteering at the student food bank, and they collected canned goods. They helped to restock the shelves, and they had written recipe cards to kind of talk about healthy eating and so that students at the university who were using this service would have that. These students also were volunteering in the different university programs that were offered throughout the fall semester, and they were also asked to present at a conference for undergraduate students, and the conference was a presentation, a 1 hour presentation on stress management, time management, proper nutrition, and healthy sleeping habits to help undergraduates become successful and with their academics, especially during the pandemic. A second group that was developed was the Parkinson's Mental Health and Wellness Initiative. These group of students met with a local organization that provides Parkinson's boxing, and they looked at how they could help at this time with the mental health and wellness of these individuals. And so they began by providing handouts for the participants. These handouts could consist of breathing exercises, promoting mindfulness and relaxation techniques, nutrition, proper diet, looking at physical, building up their core, providing a home exercise program using modified yoga positions, and developing an activity book for these participants. And they had a really great success from all of this and learned a lot with this organization. A third service learning group that we looked at was a sensory room at a foster facility. These students met with the organization and looked at what type of environment that they could provide for these children at a foster facility. The environment that they decided on was a calming type of environment, that these children sometimes may have increased anxiety, emotional outbursts, and they need to go to an area where they can help calm themselves down. So these students began devising and developing weighted stuffed animals, calming task lighting, looking at comfortable seating that they developed, pulling together all types of activities that would involve reducing stress and helping provide in this environment that a child would need to go to during when they have increased anxiety. Another service group, uh, we're looking at devising a sensory room at a facility for veteran women who are experiencing PTSD. These students began by going into a facility that pretty much had a blank room, and they met with the board members at this facility, and they decided that they wanted to provide a calming type of environment. Well, before the students could even start doing anything in this room, the facility asked that students devise their vision into a virtual type of room. So the students began pretty much they had built out, so they figured out the dimensions and everything, and pretty much designed a room about what it would look like if they were to build it. And this room consisted of different types of rugs, lighting, sound system, the different activities that they would incorporate, and the reasoning behind it. And then after they devised these different pictures of these rooms and these materials, then these students presented this presentation to the board to get approval. And from there, they found out that they were approved. So this upcoming semester, the students will now assist in developing this sensory room for the PTSD veteran women. Our final group, they provided instructions on a sensory path at a school. So what a sensory path is when a child has been sitting in a classroom all day, sometimes they're requiring to be able to focus just a little mental and physical break. And so when we're looking at a sensory walk or a sensory path, um, it can be put into a hallway of a classroom and built up, or a wall of classroom and built up with all types of activities that could focus on vestibular, proprioception, tactile, visual, anything that could kind of help this child get a little stimulation and then afterwards be able to go back to the classroom and focus. And so these students met virtually with the principal and teachers at this school, and they also developed a presentation to provide to them to incorporate all of these materials that could possibly go into this sensory path at the school. So the skills that the students gained from this service learning project, they really developed great leadership skills, time management. They worked together as teams. They were very flexible and they figured out how they could meet the needs. So they gained increased problem solving, communication skills. They had to figure out budgets. They had to learn how to design things, edit things, and even educate others. So they received quite a lot of skills in this service learning project. So some of the self-reflections that the students gained from it, one of the students said, I learned that I need to be more disciplined with my time management skills and that my group members are incredibly great teammates. The experience meant a lot to me and felt very rewarding that I was part of a detailed, lengthy presentation. Another student put, I think that through this service learning project, I will be learning more about the community and the organizations around it. Also, I know I will be learning a lot about sensory rooms and how they can help different individuals. So a lot of the students self-reflected that they learned quite a bit of skills with this service learning project. So in conclusion, pretty much as a result of participating in this project with graduate students, they learned how to be flexible during this time in a pandemic. They learned how to work together as a group. They learned how to plan, problem solve, communicate their ideas as leaders, pretty much to become leaders in their profession of occupational therapy. So I feel like these were great skills that they learned that they can carry over for their job. So thank you very much for listening to this presentation. And if you have any questions, feel free to email me. Thank you.